Good evening. Welcome to the program. I'm Leland Vittert. Tonight, America is at a crossroads when it comes to the coronavirus. Do we continue a forever state of emergency, or do we blow the whistle on the COVID craziness and do our best to protect the most vulnerable among us? It's clear at this point COVID will always be with us, and we need a way to get back to our normal lives. Remember those? Wasn't bad. Put another way, what is the acceptable risk of COVID that we can all just move on? And today, a brave reporter asked Dr. Anthony Fauci just that.
I mean, the end game, which we hope and I think will occur, is that as we get more people vaccinated, not only in this country, but globally, we will see a situation where viruses will not have the opportunity. What they have right now is to essentially freely distribute and freely circulate in society, both domestic society and global society.
If you are confused, so am I. Maybe that's the point. I am sure that is an answer to a question. Not sure what the question is, certainly not the question that was asked. Again, what metrics will Dr. Fauci see and finally move on?
Oh, absolutely. I mean, there's no doubt that this will end. I promise you that. This will end.
Well, that is indeed good news, but how? When? Why? Please, sir, articulate what must happen before we can all go back to our normal lives. We are supposed to follow the science. Science involves data. What must the data show for us to move on? Because COVID will always be here. We know that. Cases will never be zero. We know that. It will always mutate. Speaking of which, first, the bad news. A case of the Omicron COVID variant that everybody is so worried about is now here in the United States. Now for the really good news. The person in question only has mild, again, very mild symptoms and is getting better. As of now, there is not a single report of a vaccinated person being hospitalized or dying from Omicron. In fact, many of the Omicron cases we know about are the result of testing people who aren't sick, like vaccinated travelers tested before international flights who are otherwise healthy. Here's Dr. Scott Gottlieb, former FDA commissioner and board member at Pfizer, explaining some of the reasons we shouldn't be worried.
The people I talk to, and you noted at the top, I'm on the board of Pfizer, feel reasonably confident. I mean, there's no guarantee of anything, but feel reasonably confident that this vaccine is going to provide a meaningful amount of efficacy against this variant.
With this new information, our leaders are not celebrating. They are using it as an excuse to consider new restrictions, including this, and this is a big one, possibly changing the term fully vaccinated not to be 2 shots of Moderna or Pfizer and 1 shot of Johnson & Johnson, but fully vaccinated might now include a booster shot. And there are new travel requirements because people are carrying a virus that at present, the Omicron variant, is at present something akin to the common cold. With Omicron, the administration has enacted sweeping new travel restrictions. The Biden administration is reportedly extending the mask mandate through March. International passengers must submit negative COVID tests 24 hours before departure. It's not formally announced, but it's coming. There's been a travel ban from 8 African countries, although there's a lot of medical experts who say travel bans not only don't work, but cause all sorts of problems. And the CDC reportedly has demanded passenger data from airlines so they can test even more people. Over the course of the past 20 months, the goalposts have changed radically. And goalposts are important because that's how we decide to end things. It's also how we decide the sacred bond between government and the people to make sacrifices as a country based on the promises. There have been a lot of promises, a lot of goalposts. 2 weeks to flatten the curve, but don't wear masks. Then wear masks. Then 4 weeks of lockdown so hospitals don't fill up. To vaccines. To the summer of freedom. Back to wearing masks with the vaccine. To the vaccine plus booster shots, but still wear a mask. Those were all goalposts that once we got past, we could get back to normal. And every time, the goalposts moved. Let's talk about a different way of looking at COVID. Forget that for a second, the goalposts. Let's talk about what really matters. Will you or a loved one die from this disease? And that's why we've done all of this so far. Let's try to answer that question. Imagine the big house, the University of Michigan football stadium this weekend for the Ohio State game, filled with a little bit more than 100,000 people. We're going to use the peak of death rates from the last COVID wave. If those 100,000 people are unvaccinated during the very peak of the August wave, 13 would die from COVID. If those 100,000 people are vaccinated, some admittedly already on death's door with cancer, AIDS, heart disease, a lot just plain old, of all 100,000, less than 2 die. That's right, less than 2. So we put this in comparison. In 2019, the last year of meaningful flu data, the CDC reports 5,902 Americans died of influenza for a death rate of 1.8 per 100,000 population. 1.8 versus a little less than 2. We don't change the way society functions because of the flu. Why are we still changing the way society functions? Because of COVID. Hold on to that thought for just a minute. And now let's consider the administration's new goalpost. More vaccines, more boosters, just a little bit more. Here's Jen Psaki today.
What's very important for people to understand, and all of you are communicating to the public about what steps they can take to go back to normal or go back to normal life, something everybody wants to do. We're all sick and tired of this virus, but we need the American people to do more who are not vaccinated to help us continue to fight the virus.
Just keep doing more. Yeah, we all do want to get back to normal life, Jen. But after 2 weeks to flatten the curve, don't wear masks, to wear masks, to 4 weeks of lockdown so hospitals don't fill up, to vaccines, to the summer of freedom, back to wearing masks with the vaccine, to the vaccine plus booster, but still wear a mask, we are perhaps just a little fatigued, dare I say skeptical, of just one more goalpost. A little bit like Lucy in the football. We, the public here, are Charlie Brown, and Lucy keeps moving the ball. We keep doing what Dr. Fauci asks. Yeah, we did that. And he, Dr. Fauci, keeps moving the goalposts. This isn't me saying that. No, it's not. We based that cartoon off of something the New York Times wrote. Here's from the New York Times. In a telephone interview the next day, Dr. Fauci acknowledged that he had slowly but deliberately been moving the goalposts. He said he is doing so, he said, partly based on new science and partly on his gut feeling that the country is finally ready to hear what he really thinks. Which begs the question, what does he really think now? Maybe it's time for Dr. Fauci and the administration to acknowledge some people just aren't going to get vaccinated. I've said before on this program, as someone who spent 5 days in the hospital with COVID, nearly died of it, and am now triple vaccinated, I am bewildered by those who choose not to get the vaccine. But I support their right not to, and it appears the federal courts do as well. Federal courts have now blocked 3 of Mr. Biden's 4 vaccine mandates. The private employer mandate is on hold, as is the government contractor mandate, as is the healthcare worker mandate. Since the federal government is either unsure or unwilling to give us the goalposts, we wanted to get some of our own from Dr. Howard Foreman, professor of public health at Yale, still takes shifts in the emergency room, also the faculty director and founder of Yale's MD MBA program. The court, sir, has accepted you as an expert, and we're glad to have you. Appreciate it, doctor. As I went through that, and you're the expert, did I get anything wrong?
No, you're right. And it's it is frustrating for those of us in medicine and public health as it is for you and your viewers. This is a changing time, something that we've never faced before in our lifetimes, and we're learning as we go.
I get the learning as we go, but is there this desire somehow to keep managing things to zero when we're never going to get there? If we've gotten to this where if you're vaccinated, it's roughly the same as the flu, how much better are we going to get?
Yeah, no. So first of all, I do think we're going to get better, but I agree with you that we need to start to set expectations for the public. What I think is not acceptable to anybody is that we should have another 250,000 deaths by next June. I still think that number is just enormous and something that we're not really accustomed to, ready for, and it will overtax hospitals in various locales. And that is something we have to sort of push back against. On the other hand, you're right. I mean, I'm at a university right now with a 99.7% vaccination rate among the students, and life is pretty close to normal. It's not quite normal. There are still limitations, but we have class. I lecture to people in a normal, crowded lecture room.
No, I get that. I'm thinking particularly in a lot of states about the mask mandate and sort of the continued vaccine emergency state and this hype that goes on. And one of the reasons we're so glad to have you, you're a professor not only of public health, you're a doctor, but you're a professor of economics, which is an unusual combination. And there's huge costs. There's huge social costs in masking and keeping kids in school in masks and enclosed in plexiglass and not being able to play with their friends, not being able to see their teachers. There's huge social costs and people not going out for other doctor's appointments, and we're seeing an increase in drug overdoses. Do we need to start dealing with the economics of not getting back to fully normal?
Yeah, so first of all, again, if we're in high vaccination regions, we're pretty damn close to normal. In the state of Connecticut, students are mostly back to normal. Masking is used indoors in some settings, not in others. So we are much closer to normal. This is a true sort of public health as opposed to healthcare issue, in the sense that there are substantial negative externalities associated with my getting COVID or positive externalities associated with me getting vaccinated, meaning that my getting vaccinated doesn't just help me, it actually helps people around me. And that there are externalities associated with a lot of things related to public health, including smoking, including obesity, and so on. And we have measured responses for each one of those. I'm in agreement with you that we're not going to get to zero at all. We're not even going to get close to zero. It may even be the case that we lose more people to COVID for the rest of my lifetime in a year than we'll ever lose from flu. So I think that's all reasonable. The question is, how do we transition to a time where we're not overtaxing hospital systems so that we're constantly shutting down elective surgeries? How do we prevent large numbers of people dying in one community or another over time? And we're still feeling a way around that.
No, I understand that, but if we accept the idea that there's about 10 or 15% of the population that's just not going to get vaccinated, and I think reasonable people can get to that point now. For whatever reason, whatever their reasons are, we'll leave that aside. Okay, do we have to accept at some point that that's just the way life is going to be, and you can lead a horse to water, you can't make it drink, you can't make everybody wear seatbelts, and you can't keep everybody from smoking?
Yeah, look, my ideal world in the future is that we have situational masking only during peak periods of transmission that occur in your particular region, maybe on subways, maybe on buses, things like that.
Wow, so you're leaving open the possibility that masking is going to last in perpetuity?
In very limited ways. I mean, like right now, I'm in my office. When I'm in the hospital working in an open environment, far away from other people, I'm not wearing a mask. I think for the most part, we're going to get back to that.
Yeah,
When you're around,
let me ask you this way. If I'm vaccinated, the numbers I got were about right. If I'm vaccinated in an otherwise healthy individual, the chance of me dying is pretty much statistically insignificant, right?
Correct.
Okay,
Yep.
So at that point, why do I need to wear a mask? We don't, for example, it's about the same as a flu. We don't have vaccination card checks to go into a concert during flu season. We don't wear masks during flu season, even though it's just as deadly. What am I not understanding here?
Yeah, so I think the public in general believes that masks are worn to protect me and that you're wearing a mask to protect you. And that's just not the case. You wear masks for source control. And the likelihood, as you just pointed out, you still have a reasonable chance of getting COVID. It's substantially reduced because you're vaccinated, but you have a reasonable chance still of getting COVID, and you have a reasonable chance of still being able to transmit it, however reduced both those numbers are. If you're taking care of a critically ill elderly person in your home, you're definitely going to be wearing a mask.
Well, right. Those are unique situations. But I guess on the broad spectrum, the idea of a mask mandate on planes and everything else, how is it that I have a responsibility to wear a mask when somebody has a choice to make it effectively that they're not going to die from COVID. They're not going to. It's the same rate as flu. I just don't understand what social cost do we say, okay, we're going to just all move on?
Because we're not just protecting the person next to you, but you're rather protecting them from getting it and then transmitting it to somebody else around them.
And should there be any public health value to this my sanity of not having to wear a mask and listen to flight attendants yell at people to put masks on in between sips of coffee?
Yeah, look, I think we have situational masking. We shouldn't have blanket indoor masking requirements. I think we need situational masking. People need to be reasonable about it. We have to realize it's not all or nothing. It's not that if you wear a mask 99% of the time and have it off your face 1%, you're a bad person. We need to get to a point where people are wearing masks in situations that put others at risk, particularly those around you who you don't know about their vaccination status, quite frankly, or frankly, people who might be vaccinated but are elderly or immunocompromised and cannot be immunocompetent.
I guess, and I hate to get it back to the very thing, but I'm reading the lower third line, the COVID question, how does this end? What I'm hearing from you is it doesn't. This is forever.
Well, no, because I'm actually on record about being that we're very close to a lot of big breakthroughs. The Merck drug is about to get approved. That will reduce some of the lethality of this.
But once the Merck drug is reduced, once the Pfizer drug is approved, then do we decide not to wear masks?
I think we've got to get to a point where people come to grips with the idea that if we lose 100 or 150,000 people to this every year for the next several years, that might be acceptable to us. And then we make our own decisions.
Yeah.
We're going to get closer to that. We're not even close to that right now.
All right. Well, that's an interesting point. Hey, Doc, I really appreciate it. We were excited to interview you based on how you have a nuanced view of this, and we're certainly glad you were here. Thank you.
Thank you.
Yeah.
You have a good day.
Fascinating conversation. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.